This story features Martin, who has suffered from a dental phobia since he was 18 years old. His phobia prevented him from attending routine appointments with dentists over the years, only seeking treatment if it was an absolute emergency. He talks about the support the dental access team gave him at Morecambe to help overcome his anxiety.
My name's Martin Shackleton. I'm from Lancaster, up in north of the county. I trained as a psychiatric nurse, but I currently work in training and development. There was a couple of occasions where I had a dental abscess in one of the roots that was remaining in my mouth. So my mouth would swell up, I would have severe pain, and I just got to the point of thinking, well, no, I really need to do something about this because it can't go on. So I talked to the dentist at the time, who basically said, well, there's a couple of routes we can go down. One is to go for a general anaesthetic at the hospital at Lancaster. The second route would be to go down some form of talking therapy with a bit of Valium to sort of get me to the position where I could deal with it. The third route was to go down CBT, cognitive behavioural therapy, and the fourth route was ignore it and keep going back. So just before Christmas, it would be, a little while before Christmas, I got a little bit fed up of this, of myself really, and wandered into the dental access clinic and basically said, well, let's try going down the CBT route. And my logic behind that really was that if I didn't, and I didn't become accustomed to it by doing that, I would be going through the same process again every time. The process for starting the CBT involved having an interview with one of the dental nurses at Morecambe. She went through what the expectations would be, the fact that I'd be given homework and all these bits and pieces, and that we would look at some form of desensitisation. So I was sat in the chair, which was okay. It wasn't a particularly nerve-wracking experience. She then talked through the processes, explained the various bits of tools that are attached to the chair. At that point, she then started coming along with trays of tools that the dentist would use, and going down the desensitisation route, and do you want to handle this, blah blah blah. And I was fine with that. There wasn't an issue. She then got the drill out and we had a play with that, and again, not a problem. The tools, there's no threat from them, it's the person holding them. And I think what really helped at that point and before was not being treated like you were an idiot, that you weren't, whilst this wasn't a normal reaction to going to the dentist, you certainly weren't made to feel that it was abnormal or that there was something particularly wrong. I've now gone through a whole raft of therapy, dental therapy, sorry. I've had injections in every corner of my mouth. I've had them drilling for oil. I've had them digging teeth out, and there was absolutely no problem with it. By using the practices from CBT and the breathing and the working out what's the worst that could happen, and all the other bits and pieces, that I can deal with it. The dentist herself, again, during every bit of it, was absolutely brilliant. There was no, oh, we've got 10 minutes, I'm going to do this because I've spotted this. It was a case of, well, we've got 10 minutes, we could do this, or if it's too much, we can make another appointment, so you've got time to think about it. There was never any pressure. It was very much that I was in control. So it was a 3-month journey, I guess, from start to end. But I've come out to the other side of it. I'm a firm believer in CBT now. I think that this should be made available everywhere, and it may be, I don't know. But yeah, it's changed my life, really. So. every member of that team played a part in helping me, and I really cannot thank them enough. Unfortunately, I think that I probably won't see them again because I don't need to. I now got to go and register with another dentist and all the rest of it. But I really want to pass on my thanks and, the understanding that the difference this has made to my life in terms of going forward. It's a big difference. To not feel any anxiety at all the last time I went to the dentist, which was for a filling, is an amazing feeling. Isn't the word, but lack of feeling, lack of the feelings that I used to have. So a really, really big thank you.